Talking to children about death can be difficult, especially when the cause of death was homicide. However, it's very important to respect the fact that children need to process and grieve just as much as adults do. They will need the help of a safe, secure adult to guide them through their feelings and help make sense of what's happened in an age-appropriate way. Children between 3 and 5 years old don't need to know all the details surrounding a death, partly because they might not be able to fully understand the information. Young children live in a dual state of reality and fantasy. They're coming to learn about the world at the same time as having vivid imaginations. They're not able to separate the two and may fill in the bits that don't make sense with their own interpretation of the information. It is important that they're given enough information to make sense of what's going on, but you should keep in mind that having all the details might be overwhelming. Telling a young child about death can feel scary, and you might find that you're battling with many of your own emotions too. Although this is an emotional time, it's important that you can tell the child about the death of a loved one in a calm way to avoid sending their brain into something called survival mode. If you approach them when you're crying and upset, they will quickly pick up on your feelings and they'll take them on, even before they know what's happened. This is overwhelming for a child and can often cause them to flip out of rational brain, their thinking brain, and into their reptilian survival brain. Now, when they're in survival brain, they'll be less likely to take in what you're saying. They won't be able to remember the information and they'll be more likely to run away, get angry or shut down. To avoid this, try to approach things as calmly as possible. When you talk to them, try to follow these guidelines. Get down on their level and ensure you're giving them eye contact. Have them on your knee or hold their hand as you're talking to them, and this will help them feel more connected, supported and safe. Speak in a calm, caring tone and try to maintain this throughout. Tell them in a simple way so they can understand what things mean. For example, you might say, "Tilly, Daddy has died and this means he won't be here and we can't see him anymore." Then key into their emotions straight away so they can understand what they're thinking and feeling in that moment. It's very, very sad. We're all feeling sad. Or you might say, "It's very confusing to think he's not coming back, isn't it?" Give them a hug, hold their hand, or rub their back as you say this to provide some comfort. Try and avoid comments like, "You're a big boy, come on, dry those tears. Be strong, it'll be okay." Or, "Wipe those tears." All these statements can cause a child to feel like crying is weak or the wrong reaction to the situation. They may think they're not allowed to show their feelings, so they'll swallow them down and suppress them. This can later result in anger, anxiety, or difficult behaviour. Letting children express their feelings is healthy and it's an important part of grieving. So, instead, respond to their immediate reactions and reflect their emotions back to them. If they cry, give them a hug and say, "It's really sad to hear Daddy has died. We all feel sad, and it's okay to cry. I'm here to cuddle you." This allows them to feel validated, heard, and safe enough to express their feelings. If they run away, then allow them to. Avoid chasing them or becoming frustrated at their response. They're allowed to be overwhelmed and they need some space to process it. Once they've had a few minutes, go and check on them and say, "This is really upsetting news and you just want to be alone for a while. I bought you some water, and when you're ready, you can come and give me a big hug if you want to. Sometimes hugging helps." This lets them know that they are loved and noticed, but it also communicates that you respect their space. Bringing them something like water is nurturing and will increase their feelings of connection to you, even if they don't want to hug yet. It's important you prepare the child for how they might be feeling in the hours, days and weeks after hearing this news. You could do this straight away when you're telling them about the death, or wait until a little bit later, after they've processed some of the information. The sooner you can help the child understand the feelings they're facing, the better prepared they will be to handle them. For example, you might say, "Now you know Daddy has died, you might feel really confused, and I'm here to help you with those feelings. Sometimes you might forget that Daddy's died, and when you do remember, it might make you feel sad again. You might feel okay some days and sad some days, but that's normal, and you can talk to me whenever you have a big feeling and I will help you." Remember, every child needs help to understand their feelings, especially little ones. This might seem like a lot of information, but it will help them make sense of what's going on. You will need to talk to them about their feelings as much as you can in the coming weeks so they can process their emotions in a healthy way. Try and avoid statements like, "I'm sorry but Daddy has died," or "We've lost Jack," or "He can't be with us." Statements like this can be confusing and can complicate an already difficult situation. "I'm sorry" might lead the child to think that it's your fault in some way. "We've lost Jack" can confuse them and they might think he's coming back. "He can't be with us" sounds like he could be, but he isn't or doesn't want to be. So keep your explanation simple, to the point, and focus on the feelings of the child so that you're the safe, supportive presence they need as they deal with their grief.